Welcome to a new episode of Science in Context. I'm Sabine, and this week, Christian Morgenstern joins me to speak about SARS-CoV-2, the virus that causes COVID-19. Christian, you pulled together for this study a lot of different bits of data. Can you explain a bit more what you looked at?
Sure. Early during the COVID-19 pandemic, SARS-CoV-2 testing was limited to healthcare workers in the healthcare setting. But from May 2020 onwards, testing became more available to the general population. We took this general population testing data, and that included over 12 million positive PCR tests, over 400,000 hospitalizations, and over 100,000 deaths, alongside with information on each one of these individuals about their age, their sex, their ethnicity, the local authority they live in, and most importantly also their vaccination history, to really understand how different groups were impacted differently by the COVID-19 pandemic.
What were your key findings and how was this impacted by vaccination?
The risk of infection was highest in the most deprived areas relative to the least deprived areas, and we found that for the wild type and the alpha period. Severe disease, which we defined to be cases which require hospitalization or which led to death, had significant disparities throughout the pandemic. However, we found that in the post-vaccination era, these disparities were much reduced, although substantial disparities remain at the end of our study period. We also find higher risk in non-white ethnicities. However, vaccination played a crucial role in reducing those over time.
What does this better understanding of these disparities mean for policies going forward?
We need to consider questions of socioeconomic and ethnic disparities early on in the pandemic. For example, individuals of South Asian ethnicity are overrepresented in the healthcare workforce relative to white ethnicities, but we also have a much higher risk of comorbidities such as metabolic disease, which we know adversely impact COVID-19 infection outcomes. So we need to design our response with the individual and their needs in mind to enable a more equitable and just response to the pandemic.
Thank you so much for your time today.
Thank you.